Okay, welcome back to the last in our series on pain management. I am, of course, here with Dr. Dermot McCoy, specialist pain medicine physician. And in this last video tutorial, we're going to be covering the issue that's probably been hot on your lips, and that is around how to manage back pain. What do we do with back pains, and why is it so problematic in terms of being able to get solid and reliable advice in terms of treatment and procedures? So, Dr. McCoy, could you talk to us about back pain and why it's such a challenging area to manage in terms of pain?
Extremely challenging, extremely common, and one that probably 80 to 90% of us are going to experience at some point in our life. We must remember that we are four-legged animals. We have exactly the same number of bones as a giraffe or a dolphin or an orangutan. But over the millennia, we have decided to stand upright. And many of the forces that we put through our skeleton are concentrated in a specific part of the axial skeleton. This is the straight up and down part of your spine. And it changes in direction and it changes at angles. And one of the biggest change in angles and direction is down at the lower part of the back, where the low part, the lumbar spine, meets the sacrum. In other words, I'm talking about this area here. Every bag of groceries, every time you lift a book, a litre of milk, or try to lift a wheelbarrow in the garden, forces are going to go through that part of your spine. And is therefore shouldn't be a surprise that that's where we experience the pain. There have been a miscellany, a whole variety of treatments, injections, surgery, manipulation, massage, dry needling, and on it goes down through the years, which have been offered for the management of back pain. So why can't we manage it a little bit better? Well, we have to actually go into the sensory nervous system and think, where is the back represented at brain level? This grotesque figure is a representation of how much sensory information gets to your spine. Obviously, our hands are very sensitive. Our special senses of the hearing, smell, taste, and seeing are very, very highly represented. If you turn it around, the little part at the lower part of the spine gets as much representation as the tip of the little finger. So we can't exactly pinpoint where in your back the pain is coming from. Is it coming from the capsules? Is it coming from the discs, the joints, the bones, the tendons, the nerves, the ligaments, the muscles? A combination of those things, or is it referred pain? Is it radicular pain? And so it gets more complex. We can, however, determine some things about it. There is an entity now that's being bandied about called non-specific low back pain. We never talk about non-specific cardiac pain or non-specific headache. So we should try to make non-specific back pain more specific. And we can do that by eliminating structures that may not be causing the pain and in pursuing structures that are highly suspicious of the pain. We talked a little bit about the role of radiology, and that looks at the spine and gives us excellent images, but doesn't tell us where the pain is coming from. By applying local anesthetic to different elements of the spine, it can be determined or eliminated whether a particular structure is the cause of the pain or not. So for example, we can do precision diagnostic blocks by putting small amounts of local anesthetic onto the nerves that supply the facet joints, the little zygapophyseal joints in the back. If the patient reports a decrease in pain and then a return of pain as the local anesthetic wears off, we can determine that that is the main cause, or at least provides the main cause or main generator of pain in the back. We can suspect that if there is a disc tear, that might be causing the pain. Surgery for back pain, thankfully, has been less of an element in managing pain in recent years. And the neurosurgeons and spinal surgeons, particularly here in Victoria, are less likely to offer these invasive surgeries for the management of pain. They are appropriate for some structural abnormalities of the spine or indeed for trauma. This is where the whole multidisciplinary aspect of pain is so important. The specialist pain medicine physician will bring into play physiotherapy, occupational therapy, surgery, radiology, etc., into determining where the pain might be arising and how best to treat it. There are all sorts of investigations, all sorts of injections and therapies that we can offer. The Faculty of Pain Medicine, the International Society for Spinal Injection, and various other well thought of international bodies can determine the evidence base for specific interventions. Some of them come in and out of fashion. Some of them are robust and stay the course. But it really is the judicious use of the best evidence for the treatment of the individual patient, which is actually the definition of evidence-based medicine, should be used and is best used by the specialist pain medicine physician for the management of back pain. And this can be broadened out to shoulder pain, which is also very troublesome, neck pain, and lower limb joint pains. That's a huge subject to cover in a very short period of time. But the basis is there are ways of making a non-specific subject a little bit more specific and being a little bit more judicious about the treatments we offer.
Okay, so very comprehensive coverage of how to, or the different options available for trying to identify the source of back pain and options available for managing that. So thank you so much, Dr. McCoy. I think it's absolutely highlighted the important role that the specialist pain medicine physician has in terms of getting accurate and reliable advice around managing pain on an ongoing basis. So Dr. McCoy is, of course, a treating pain medicine physician, and he's also a medico-legal expert and is available, of course, to provide his opinion and advice on any cases that you may have available. He's also made himself available if you have any particular questions regarding any of the video tutorials that we've covered in this 14-part series, to please reach out either directly to Dr. McCoy, or you can reach out via the MedDirect website, and that will also get to Dr. McCoy. He'd be very happy to answer any further questions that you might have, or if you'd like to perhaps have him do a webinar to your teams as well, he'd be very happy to do that. Dr. McCoy is available for medico-legal consultations in Geelong and in Melbourne, Victoria, and is also available for conducting video conference assessments to help you support better case outcomes. So thank you again, Dr. McCoy. We very much appreciate the time and the expertise that you shared with us over the last 14 video tutorials.
Thank you.
Thank you.